Total Orthopedics is a place where thousands of people are assisted daily by advanced specialists. We will now look behind the scenes of this unique medical mechanism and learn how doctors here are restoring people's mobility and quality of life.
Well, I'm Dr. Charles Rotolo. I'm the president and founder of Total Orthopedics and Sports Medicine. I specialize in arthroscopic surgery and sports medicine, and in particular, it's shoulder surgery, elbow surgery, and knee surgery.
And doctor, can you tell us, how did you build Total Orthopedic into the leading orthopedic practice?
Well, I think I'm the founder of this, and I started this in 2004. I was a sole practitioner there. But what I've done over the years is slowly added orthopedic specialists that, almost all of them subspecialize in something that we've added to the group where we've made Total Orthopedics a leading orthopedic practice in Long Island.
What do you think that makes Total Orthopedics' approach when it comes to patient care different from the other orthopedic practices out there?
I think a lot of orthopedic practices are just, shuffling patients in, they're moving through them pretty quickly. I think one of the things that we pride ourselves on is that we give a full comprehensive evaluation of a patient. So when you come into Total Orthopedics, we're going to see you, take your history, do a full physical exam, look at your studies. We'll go over your studies with you so you can understand what your problem is. And then from there, we'll go over like the comprehensive plan of what your options are to do with whatever your problem is. And so I think this is very important because there's not, with any diagnosis, there's not the same treatment for that diagnosis for every single patient. And you got to put it all together where this person is in life and what they're looking for. So we'll go over your different treatment options. What are the risks and benefits of each one of those treatment options? And then what does it mean to sign up for that treatment option? If you do sign up for a surgery, how long are you going to be out for? How long till you go back to work? How long will you be in a sling for? How long are you going to do physical therapy? What is the physical therapy? And so I think when you leave Total Orthopedics, you'll at least have a full understanding of what your problem is and what your choices are.
As far as the diagnostic and treatment modalities that you have available for patients here at Total Orthopedic, can you tell us how the practice kind of sets itself apart as far as what the things that you offer?
Well, the other thing is a patient coming to Total Orthopedics has a full array of diagnostic capabilities for that patient. So we certainly have x-ray when you come in. We have ultrasound, and we use that a lot for most of our injections. And we have an MRI. We have an MRI in our Massapequa office. We also have a very strong open MRI in our Syosset office. It's the strongest open MRI that you'll find in Long Island.
Now, the concept of an orthopedic urgent care, that's not something that you see often. How did you come up with that concept? And tell us about the 4 different locations that you have for orthopedic urgent care.
Yeah, so we started an orthopedic urgent care in Long Island over 10 years ago. And the whole idea of this was, like, when you have an orthopedic injury, you want to be seen by an orthopedist right away. You're injured in a way that, probably sitting in an ER for 8 hours is not what you need, but you need to see someone. And so the whole idea is that orthopedic urgent care is we're open up 7 days a week. You can come in, get evaluated by an orthopedic specialist, get x-rays, figure out what your problem is and how you want to be treated. And we have orthopedic specialists. So if you have a fracture that needs to be reduced or a fracture that needs to be splinted, we'll get that reduced the correct way. We'll get it splinted the correct way. And then from there, we'll get you set up to see an orthopedic subspecialist. And I think what sets us apart is if you go to an emergency room, you go to a regular urgent care, they're going to tell you to go see an orthopedist. You might wait weeks to see that orthopedist. And when you get to see him, they might say, you know what, you need a subspecialist. You need to go to this other person. So the whole idea of this is quick access to someone. It's 2025. That's what it's all about. Nobody wants to wait for anything. It's quick access, get the person seen, from there, get them to the right person or get them into therapy, but get their treatment started so they're not losing time and not being treated.
So can you tell us, doctor, what exactly does a sports medicine physician and surgeon actually do? And how do you help athletes as far as treatment of injuries?
So it's funny. The term athlete has changed over the years, and I have a lot of athletes now that are in their 80s and play pickleball, and I have some athletes that are 15 and they're playing soccer or playing football or something. So I think sports medicine means that you're focusing on athletes and focusing on return to sport. But the other big thing about sports medicine is you're talking to patients about trying to get back to things that they love to do, because sports is one of the things that makes us all happy. And so that's the idea is, like, it's not just, all right, like, you have this problem, don't do this, don't do that. It's, you have this problem, how can we get you back to doing what you were doing before?
So what are some of the most common sports injuries that you see, and how do you treat them here at Total Orthopedic?
My most common surgeries and the most common things I treat are rotator cuff injuries, shoulder injuries such as dislocations or labrum tears, and knee injuries such as ACL tears, meniscus tears. I also do a myriad of different elbow surgeries as well. But those are the most common things, and especially shoulder injuries are ubiquitous in today's society.
Why are shoulder injuries so common these days that you see in the
Well,
patients that you treat?
certainly shoulder injuries can be from a bunch of different things. It can be from your job where you're working because you're lifting a lot. You could be an electrician working over your head all day long, or a sanitation person, lifting garbage all day long. You could be a police officer who hurt their arm trying to restrain someone. So just on the work side, it's a very common thing. And then on the sports side, whether you're playing tennis, pickleball, baseball, all these different sports, you certainly can injure your shoulder.
So what types of physical therapy do you offer here at Total Orthopedic, to help patients prepare and then recover for surgery?
So at Total Orthopedics, we work closely with Total Physical Therapy, which is a group that we work alongside with. They provide excellent physical therapy, and for there's many different injuries that we have where really all they need is physical therapy, and so for many shoulder injuries, physical therapy has a 75 to 80% success rate in treating patients. Usually they'll have success early on in the first month or two. And so many patients, when they come into me, even though I'm a surgeon, I'm not prescribing surgery, I'm prescribing physical therapy. It is therapy tailored to what they have. It's just not some generic thing that you're going to. And I think that really can help people a lot.
What type of music do you like to listen to in the operating room?
So that's an interesting question. So, um, certainly, I work in a team. It's myself, a PA, and another physician. We've been working together for many, many years. So sometimes I feel like I'm on an indie pit crew. We're just moving along. Everyone knows their job. Everyone knows what they're doing. And with that, I like fast, loud music. So not too loud that the nurses don't hear what we're doing, but we listen to hard rock. We listen to some 90s alternative music. Sometimes when I'm working by myself, I'm listening to a little bit of country, which much my PA hates. But outside of that, it's fast, hard.
Is there anything or what's one thing that you tell your patients not to do that you do yourself?
So uh, I've I've always gone over with my patients what are things to do, like to not re-injure your shoulders, and even though I I preach to them certain things, I know myself. Like sometimes I'm lifting heavy weights over my head. I'm doing some certain sports where I'm much more prone to injury, and I understand it. It's a balance in life. It's the things you love and it's your long-term outcome. And as you get older, I've cut out a lot more of those things that I used to do anyway, because as you get older, you realize, your aches and pains remind you even more often why you shouldn't be doing those things. But there's, mostly it's lifting is the things that I like, in certain things where you just want to feel like you're 25 again.
What is the weirdest thing that someone's asked to keep after surgery?
Um, Weirdest thing someone asked to keep. Certainly everyone always asks for their hardware, and but I've had some people ask, like removing a cyst, where they ask to keep the cyst, or removing part of their meniscus, they ask to keep that, and I don't know why. I don't know what they're gonna do with it, but
All right. So if you weren't a surgeon, what would you be doing professionally?
think if I wasn't a surgeon, I would probably be a researcher. I'd probably be doing something in medicine where I'm working on something to help people. I think as part of that, though, I also have an innate thing where I like business. So I'd probably be a researcher, but in some type of private business where I'm also running it, because I do like running a business. There's a lot of excitement that you can have in life, and running a business is one of them.
Doctor, if you had a dollar for every torn meniscus you've seen, would you still be working?
No, no. And what's funny is a lot of people come in and they say, I have a torn meniscus, I need surgery. And most people don't. 63% of meniscus tears don't hurt and is not really the reason why you have pain, or it might be the reason why you initially had pain, but is not the reason why you continue to have pain. So, meniscus tears are kind of ubiquitous as you get older, and a good surgeon is going to look at that MRI, correlate it with your symptoms, make sure it's in the location where your pain is before they jump to saying, okay, what you need is a surgery.
Which is worse, your patient's injuries or their explanation of how it happened?
So some patients have very long explanations, what they ate prior to their injury, who they were with. That said, I understand patients come in, a lot of them have prepared that story. They worked on that story for a while before they come in. So I think one of the things as a physician is just give them a couple minutes, let them say their story before you cut them off. I think there's one study, I think the average physician waits about 10 seconds before they cut a patient off. I think just letting them get through that because again, they're not experts in telling the story, so let them just tell their story.
Are there any real patient questions that keep you up at night?
Patient questions that keep me up at night. Hmm. Uh, you know, Certainly there are patients that have serious problems, and or need surgeries that will keep me up at night or wake me up in the middle of the night, and and it's the things that you perseverate about. And I think if your surgeon's not worried about these things, is not thinking about these things, you got a cavalier surgeon, you might want to go somewhere else. But I have certain nights where I wake up a couple times during the week because I know I have a patient with a big problem that I have to do, and I'm just thinking in my head, did I cover all my bases? Do I have plan A, plan B, plan C? Is everything going to be there? Did I do everything else that needs to be done? So it's those are the things that really keep me up.